Hi, my name is Savannah Parisi. I'm a student nurse at the University of South Alabama, and I'll be performing my urinary catheter insertion today. There's my ID. First thing I would do, entering the patient's room, verify hospital policy, verify the order. I would also verify, after doing that, I would perform hand hygiene, and then I would verify my patient using two patient identifiers. Jaguar Jones, date of birth 08/25/1963, date of birth 08/25/1963, MR number 4176352, MR number 4176352. My patient is also allergic to penicillin. I will explain my procedure to the patient, provide as much privacy as possible. After doing that, I am also going to state the 3 indications of needing an indwelling catheter, which is required immobilization for surgery, trauma, or other therapies, acute ventilator-dependent respiratory failure, and acute worsening of the mental status. Next thing I'm going to do is gather all my equipment, put on my goggles, move my trash can, and perform hand hygiene. After doing that, I'm going to heighten the bed to a working position, lower the side rails, and put my patient in dorsal recumbent position with their knees bent. After doing that, I am going to just put on gloves, and I'm going to clean my patient's perineal area. For women, I'm going to start from the outside, then in, top to bottom, using a different swab each time. For men, I'm going to do a circular motion from the tip all the way down to the shaft, using a different swab each time I clean it. After I do that, I'm going to take this out, use this as a trash bag. I will open this, position it, and then I'm going to put on my sterile gloves. Okay, then I'm going to open this sterile field. Yeah, doing that thing. Okay. After doing that, I'm going to put my tray stuck in there on my field. This field close to my patient. I'm going to take these swabs out, and then I'm going to open up this loop and put it on my tray. I am also going to attach this to the balloon portion of my catheter. Okay, then I'm going to clean, my patient. So I would take my non-dominant hand, position it like this, take a swab, down, dispose, down, dispose, down, dispose. And then I would take this catheter, I would lubricate it in the lubricant. For women, 1 to 2 inches. For men, it's 5 to 7 inches. For women, I would insert it. I would insert it 2 to 4 inches inside until I get urinary return. For men, I would go all the way down to Bicardium. Yep. Bicardium. Okay. So then I would tell my patient I'm going to insert the urinary catheter inside of you. So I'll move this box closer. And I will insert. And then I'm going to insert this all the way. I'm then going to hold this and pull it out a little bit, there's a return, and then advance it 1 to 2 inches. Then going to remove this, put to the side. Okay, put this over here. Take this. I'm going to use my sat lock. I would go to the patient's leg. I would clean it off. I would attach this. Patient's leg. And then I would hang this that side right here. Okay. All right, and then I'm going to demonstrate how I would take it out down there for a urine sample and then up here for a portal. So the first thing I'm going to do is do this, put it on a sterile field with the cap up. I'm going to come over here, take it out of this, and here. Okay, and then when I fill it all the way up, push it back, put it back inside, if I can. Okay, and then I would recap it. Alright, and then if I were doing it from the portal, I would take a lower lock syringe, which I don't have, so I'm just going to pretend that this is one. And I would go to this portal site, making sure it's clean and sterile. I would insert it, and then I would take it all the way out, filling the syringe. And then I would come over here, and I would empty it out into this, dispose of this, and put the cap on, label it, send it to the lab for both of them. After doing that, I'm going to make sure my patient's comfortable. I would remove all of this. Remove all of that, make sure my patient's comfortable. I'm going to raise the side rails, lower the bed to a comfortable position, have the call button nearby if I need anything. When I'm assessing the urine, I'm going to be looking for the color, the type, the consistency, the amount, how my patient reacted when I'm like documenting. And then after that, I'm going to demonstrate how I would remove one. So I go over to my patient with their catheter. I would explain to my patient the order, what I'm going to be doing. I would, these would already be removed, but I would put on regular gloves for this procedure. So I'm going to tell my patient I'm going to be draining the bag first into, can't think of the word for it, into this cup. And then I'm going to drain it all into here, and then I'm going to take this, I'm going to insert it to the port, I'm going to demonstrate moving this in and out, and then I'll go back 1/2 milliliter, insert it, and then let gravity do the rest. Okay, and then once that is finished, I'm going to tell the patient I'm going to take this out. Tell them to do relax, take deep breaths. I'll remove it. I will dispose of this, put that over there. I will then also clean the area again, dispose of all of this. Yeah, clean the area. I would also assess the urine that I just took out of that for the odor, the consistency, the color, how my patient reacted to the procedure. I would also explain, I don't think I mentioned this, but I would explain to my patient the symptoms of a UTI, which would be like burning when urinating, painful urination, frequent urination. You are also going to be assessing the patient every 4 hours to make sure nothing's infected and everything's working correctly.